Dr. J, welcoming you to this video in which I'm going to talk to you about reflexes in the newborn. These are also called primitive reflexes. Now, reflexes are involuntary movements of body parts. They can be either spontaneous during the usual activity of the baby, or they can also be in response to certain stimuli. For example, light, touch, and sound. These reflexes tell us about the normal brain activity of the baby, and they must be present. And the reason why I'm saying this is because many a times I see young mothers come to the clinic very worried about these movements, about this bizarre kind of shaking of the body and so on, and they're really concerned. And I'm repeating that they signify normal brain activity and must be present. Absence of these reflexes is a cause for concern for pediatricians. Now, sometimes you will also notice some trembling or shaking, mainly around the chin, of the arm or the leg. This is simply because of immaturity of the nervous system. And this just gets better with time as the baby grows. I'm just going to go through a few important reflexes. Number one is called the root reflex. A root reflex is once you stimulate the angle of the mouth, either with a finger or by the nipple, the baby turns the face towards that stimulus. And this is nature's way to tell the baby to look for food and to grab the breast. The second is called the sucking reflex. When the roof of the mouth is stimulated by the breast of the mother, or even by a finger, or by a pacifier, the baby starts to suck vigorously. Sucking reflex is really the second step to the rooting reflex. This reflex starts to develop at around the 32nd week of pregnancy and is fully developed by about the 36th week of pregnancy. That is why in preterm infants who are born before their time, this reflex is not very strong. The third one is also hand-to-mouth reflex. When the baby takes the hand near the mouth, immediately grabs it, starts sucking on it. Now, sometimes mothers get confused and they think that it is a sign of teething. No, it is not a sign of teething, it is just a reflex. Now, this reflex will usually go away by 4 months of age. The next reflex is called the Morrows Reflex, or it's also called the startle reflex. And it is in response to a loud sound or to a certain movement of the body. The baby throws the head back, extends the arms and the legs, cries, and then draws the arms and the legs together and stops to cry. And very often, when you take your baby, the newborn, to the doctor's office, the doctor is going to hold the hands of the baby and let go to see whether the Morrows reflex is present or not and how well defined it is. So when the doctor does that, don't worry. It is just part of a routine check. The next reflex is called the tonic neck reflex. When the baby turns the head on one side, the arm on the same side goes out and it extends, and the opposite arm bends at the elbow. This reflex usually goes away by about 6 months of age. The next one is called the grasp reflex. If you place your finger into the baby's palm, the baby can hold very, very tight, and sometimes so tight that you can actually lift the baby. The grasp reflex usually goes away by about 2 months of age. The next one is called the Babinski. If you stroke the sole of the foot, then the big toe goes back in this direction and the other toes fan out. This reflex lasts up to 2 years of age. The next one is called the stepping reflex. If you hold the baby upright and you let the feet touch the surface, the baby starts to take a step forward, or it starts a little dancing movement. So that's why it's also called the walking or the dancing reflex. And many a times mothers get very excited. They think that the baby is starting to walk. No, this is just a reflex. So this is about some of these primitive reflexes, and as I said earlier, they are important, they should be present, and absence of the reflexes can be a cause for concern. So don't worry about these movements because, as I said, eventually with time they go away and as the baby matures. Thank you for watching this video. I'll see you in the next one soon.